is now.
We face a crisis, something that needs our attention and immediate action. The solutions are within our reach, but only if we decide to act decisively and with critical attention. In 2019, Chennai faced one of its worst drought in its history, leading to day zero. All of its major reservoirs dried up, leaving its 11 million residents access to no potable water. I personally remember waiting for tanker water to come, only to receive 2 gallons per week. Now, Chennai is not alone. A UNDP report suggests that India's major cities, as many as up to 21 cities, may face drought-based situations by 2025. Scary, right? The irony is that Chennai as a city also loses more than 54% of its drinkable water due to leakages, contamination, and other systemic inefficiencies. Can you make a guess how much big the number could be? It's a staggering 600 million liters per day. Take Gujarat, for example. Its cities have experienced one of the fastest growth in their history, coming only next to Mumbai. It plans to contribute more than 10% of the GDP to the country, expanding its economy to $500 billion by 26-27. Yet, under this development sits a harsh reality. Gujarat also ranks as the second highest number of manual scavenging deaths in the country. This is the result of using traditional and obsolete technologies that puts human lives at risk. Now, it used to really bother me. मैं सोचता था यार, इंडिया में we have developed so many groundbreaking technologies, and yet common issues like water and sanitation that affect more than a billion people in the country yet remain unresolved. So, in 2019, as a part of my final year project, I and my professor developed India's first robot for cleaning septic tanks and manholes together. And you know the first thing that we did? We gifted it to Nagamma, the wife of a Safai Karamchari who lost his life cleaning septic tanks. Now, over the past few years, I and my co-founder Moinak Banerjee, we developed several technologies that could help urban water and sanitation. We have developed technologies for leakages detection, contamination detection, elimination of manual scavenging, and so on. Over the past few years, we have worked in more than 25 cities, solving some of the most complex problems in water and sanitation. In one of the cities where we worked with, almost equivalent to Surat, we were able to save more than 40 million liters of water per day just because of using technology. Now, I've come to realize that solving for such problems may not have been possible a decade earlier. You see, such public problems often require the support of the ecosystem for it to happen. I have come to realize that there are 4 things that enable anyone to solve these problems. I call it my 4P theory. Let me share that with the example of my own story. The first P is passion. To solve some of these problems, we really need to care about it. We need to really dig deeper, like literally, and try to understand why the problems exist in the first place. In case of water, for example, imagine the water coming to your house comes through a complex network of pipelines underground. Most of the times, we don't even know when these pipelines were laid, where these pipelines are, and what could be their condition. The lack of this measurement almost makes it seem like the problem is not urgent and critical. On top of that, changing anything requires heavy capital infrastructure investment. And we all know that cities rarely make money. So it becomes like a chicken and egg problem that without investment, we can't improve the infrastructure, and without the infrastructure, we can't improve efficiency. And hence, solving for such problems requires a technological breakthrough, something that can change the game. Which brings to my second P, which is the power of technology. Now, imagine that you are getting a contaminated water in your house. What do? You will call the corporation, they'll come in and try to dig at multiple places. We would have all seen the signs of men at work around the roads. Of course, if there is a better solution, where you can send a robot inside to exactly pinpoint the location and source of the defect. And that's exactly what we did. We created Asia's first robot that can go into water pipelines as small as 90 millimeter in diameter and look for leakages, contamination, and other defects. Now, COVID gave us another example. While earlier, it was expected that India will be one of the worst hit countries in terms of healthcare, our indigenous innovation and manufacturing put us on the top. And that's what I believe is the power of technology. Now, often, the scalability and adoption of public technologies like these require the support of government policy and private investments. This becomes my third and the fourth P. In case of water, government has set up ambitious missions like Har Ghar Jal, which translates to every house with a tap water, and missions like Swachh Bharat Mission, where they want every house to have a toilet. They've invested billions of dollars into making these missions a reality. Similarly, a Make in India mission ensures that we have the right infrastructure and the support for startups to make manufacturing a reality. The fourth P, privatization, really supports the private players coming into these investments. A good example of this is the recent sustainability and bankability of the private projects that have come in the water and sanitation sector. Similarly, in the investments as well, multiple deep tech VCs have come up with EVs, water, and other climate-related funds. Now, once we understand these four Ps, we realize that solving these problems is really possible. And I'll tell you two stories of the cities that will make you believe that it indeed is. In one of the cities, we had a massive problem of water contamination. We had hundreds of children getting hospitalized because of drinking the tap water. As you can see in this picture and the video, there are insects crawling inside the pipelines. City Corporation, despite multiple attempts, could not identify the issue. And when we were called in, we just took 2 to 3 days to actually identify the source and contamination of these defects. The second story that I have is the city of Hubli. We had more than 1,100 households who did not have access to pipe drinking water. Through our technologies, we solved about 6 to 7 blockages that enabled them to get this pipe drinking water that they were not getting for more than 2 years. Imagine these households were spending 15% of this disposable income, earning a meager 30 to 35,000 rupees a month. They were spending almost 4 to 5,000 rupees on buying private tankers for something that should have been provided for free, and we solved that. What I've realized is that water isn't the only problem that is stopping our cities from being resilient. Whether it is the air quality pollution, which we all know Delhi AQI is going up to more than 600, or the COVID-19, or even the food insecurity. We essentially need to solve for them. Only some of us have access to these packaged drinking water or the air purifiers. Now, in all of this, it is really the poor and the vulnerable who suffer the most. So, my realization is that we actually cannot solve for the country. We cannot make our cities resilient until we solve for the masses. And maybe it's time for us to start thinking solutions for ground up rather than just for the privileged. History has shown us that it is really the collective action of individuals like us who create the extraordinary. And while today, it's only some of us who are building these innovations and solutions, what if? What if I ask you, we could ignite a movement of hundreds and thousands of people who believe in solving for the country and become problem solvers? The impact of a collective action like this will be nothing short of revolutionary. And an idea that turns individuals as problem solvers for the country is an idea that can truly change everything. Thank you.